Effects of COVID-19 on the Early Hearing Detection and Intervention 3-month Diagnostic Benchmark. This research project was developed at Boston Children's Hospital with the aim of investigating the impact of COVID-19 on our ability to meet EHDI's 3-month diagnostic benchmark for children seen following referral on the newborn hearing screening. As with many hospitals, Boston Children's was forced to reduce services and close satellite locations during the early months of the pandemic in the spring of 2020. As can be seen in Figure 1, the number of services offered by the audiology department at this time drastically decreased, with the lowest number of services being provided in April 2020. During the time period of closures and reduced hours, Boston Children's was forced to limit services to time-sensitive patients, including scheduling ABRs only for newborns who had bilaterally referred. With this in mind, we wanted to compare Boston Children's ability to meet EHDI's 3-month diagnostic benchmark during 2020 to our ability to meet the benchmark during the same time period of each of the 2 years prior. We focused on the 3-month benchmark as Boston Children's is not a birthing hospital. We hypothesized that the impact of COVID-19 would result in reduced capability to meet the 3-month benchmark compared to previous years because of our office closures and reduced services. We also hypothesized that there would be a significant difference in our ability to meet the 3-month benchmark for unilateral versus bilateral referrals because of our prioritization of bilateral referrals during scheduling. In order to evaluate our hypotheses, we conducted retrospective database and file reviews of children born between the months of December 2019 and September 2020 who were seen at Boston Children's following referral on the newborn hearing screening. We collected data for the same birth month for each of the 2 years prior to use for comparison. Our inclusion and exclusion criteria can be seen in Table 1.
After analyzing the data from all 3 cohorts, we found that despite COVID-19 closures, there was no significant difference in Boston Children's ability to meet the 3-month benchmark in comparison to the 2 years prior combined. Additionally, there was no significant difference in our ability to meet the benchmark based on referral status during the 2020 cohort. However, when compared to the previous 2 years, significantly more children with bilateral referrals met the 3-month benchmark in 2020. This finding is consistent with the prioritization of bilateral referrals during the COVID-19 pandemic. When broken down into monthly data by cohort, the sample sizes were too small for accurate statistical analyses. However, some observations can be made regarding the benchmark percentages based on this breakdown. When looking at Figure 2, we can see the 2020 cohort's percentages, shown in green, exceed that of previous years for births through December and January. For February and March, however, the 2020 cohort falls behind benchmark percentages of the 2 years prior, aligning with the beginning of the COVID-19 pandemic and subsequent shutdown. For April and May, percentages seem to be comparable across all cohorts. And in later months, the 2020 cohort again seems to be outperforming the previous 2 years. We also chose to further analyze the 2020 cohort by splitting it into 2 groups, an early COVID group that included births from December through May, and a late COVID group that included births from June through September. Our analyses shown in Figure 3 indicated that the early COVID group had significantly less children meeting benchmark compared to the late COVID group. When separated by referral status, this difference held true both for unilateral and bilateral referrals. In terms of Boston Children's ability to continue to meet EHDI's 3-month diagnostic benchmark despite the COVID-19 pandemic, prioritization of ABR appointments over other diagnostic evaluations may have been one contributing factor. Furthermore, after reopening satellite offices following shutdown, additional operational hours were added in order to compensate for reduced services during shutdown. This drastic reduction, followed by a compensatory rebound, can be seen in Figure 4 and is reflected in the difference in the early and late COVID groups. Further research should investigate if the reduction of services during COVID-19 hindered Boston Children's ability to meet EHDI's 6-month benchmark of intervention. So how does our ability to meet the 3-month benchmark compare to national averages? Based on CDC data, in 2018, a national average of 49.5% of children met the 3-month benchmark following referral on the newborn screening. Similarly, in 2017, 49.2% met the benchmark. All 3 Boston Children's cohorts outperformed these averages with 67, 73, and 75% respectively. While there's still room to grow, we believe that Boston Children's ability to continue to serve its community in light of a pandemic and shutdown is encouraging.